Okay, hello all. I'm calling the June 21st, 2021 Health and Human Services Committee meeting to order. And do we have any changes to the agenda? I have one change. We're adding Frank Krupa to talk about the mental health crisis team as the 9th item on the agenda. Anything else? Okay. Do we have any public comment, Katrina?
I have not received any.
Okay. Moving on to the chair's report. I just want to, although I'm subbing for Shauna Black, I just want to talk briefly about today is Child Tax Credit Awareness Day, in case you were wondering. And it's a part of the American Rescue Plan, and it's basically a little bit different. Instead of child care credits being assigned to your tax returns, people are actually going to be starting receiving funds. On July 15th through the rest of the calendar year, payments will be monthly via direct deposit for 80% of the families, through the mail, and for others at $250 per child between ages 6 and 17, and $300 per child under age 6. You have to basically be under the income cap of $150,000. But again, you can check more information on it at childtaxcredit.gov. And so I said my public service announcement for Child Tax Credit Awareness Day. Now we're going to go to Lisa Holmes with the County Administration Report.
Thanks, Henry. I don't have too much of a report, just to say this season, this is the kind of hitting the peak of budget season. So our office has been, working on that. And in particular, I have been we've been interviewing candidates for both budget director and budget analyst position in county admin, making some progress there. Just hoping for candidates to be able to join us as soon as possible, to get as much time as possible with Kevin prior to his leaving. So that has been taking place last week and some more this week. Other than that, under the county administration agenda item, we have a resolution for your consideration, which I believe was also passed by Budget, Capital, and Personnel last week, I believe.
Okay, and do I have someone to move this item, which is appropriation to provide funding to the Public Health Department for FEMA grant revenues and authorization for the interim county administrator to execute contract with community health systems for transport expenses of community available related to COVID-19, document number 10173A. I see that Amanda has moved it, and do I have a second? And Leslie Schillers has seconded it.
And Henry, you were kind of going out there, so it was a little hard to hear you. So I think you have to talk very close to your microphone. But we could read the title.
Okay. Well, thank you very much. And Lisa, can you maybe just say a few words about this?
Sure. So this is for county administration, or for the county to provide the funding for the testing through CHS for a certain period of time, with the expectation that the county will receive the FEMA reimbursement for the testing. CHS is not eligible to receive that reimbursement directly from FEMA.
Okay. And like you said, this was passed by budget last week.
Yes.
Okay. Any questions? Okay, why don't we do, we call a vote. Called by the order I see, Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
and the chair votes yes. So that carries unanimously.
Thank you.
Okay. And now we're moving on to the, because I assume you're done, Lisa? The report? Okay. And now moving to a
Yes,
presentation.
thank you.
Yes, but we'll raise the age from Kit Kephart.
Thanks, Henry. So a couple of weeks ago, there were some questions that had come up about raise the age. And so I put together a presentation, and there's been some kind of new activity that I'll talk about in the course of presenting that have kind of made this very timely. So I'm going to go ahead and try to share my screen. Let's just see if I can actually do that with everybody. Okay. Okay, so tell me if you can see that.
Yes.
Yes.
Okay. So of course now all of you go away and I feel all alone, but on with the show. So the raise, as people know, the raise the age legislation went into effect about 2.5 years ago in New York State at this point. I'm going to cover some basic information that's specific to our county as I talk about things. Before I begin, I'm going to provide my raise the age disclaimer. When I began collecting information to present, I really expected that it would be a fairly straightforward project. And as I got into it, I realized that the process of doing all of this really crosses many county departments, as well as the courts locally. And so for that reason, it can be kind of difficult to pull all of this data together. And there are areas within Raise the Age and how we provide services that really I am not an expert on. You know, when it comes to the court process, when it comes to the legal stuff, I'm not an expert. I've asked Jan Gorvitz from probation to join us today, and so she is here if questions come up that I can't answer. She is probably more informed on some pieces of that than I am. So I'm hoping that all of this will kind of shed light on the good work that our county has done to serve RTA kids over the last couple of years. So New York State's, as I said before, New York State's Raise the Age legislation went into effect in October of 2018 for kids that were 17 by that date, and a year later for 18-year-olds. The legislation changed the age at which a child can be prosecuted as an adult in criminal cases to the age of, in criminal cases to 18. And prior to that new legislation, New York was one of 2 states to still hold 16-year-olds responsible as adults. I know that committee members actually received this presentation, and I had incorrect dates in here, or incorrect ages in here prior. I had 17 and 18 instead of 16 and 17, so I've corrected that on this slide. So in New York, children can be brought to court starting at age 7 if they're accused of committing a crime. And with Raise the Age in place, which court handles the case and the outcome for the child really depends on a number of factors that includes the child's age, their intent as evidenced by the crime, as well as their past legal history. Children that are accused of crimes fall into 3 primary categories. I'm going to cover some of the basics of each of these categories, but this is where raise the age gets a little bit complicated, as the courts can remove a case depending on the factors of that case to another court, and changing the options or interventions for a child changes as a court might remove to another court. And that part of things gets pretty complicated. I'm not an expert at that piece, so I won't be covering all of that in detail today, but hopefully enough to kind of get us through. So raise the age changed the juvenile delinquent and adolescent offender categories effective October of 2019. From that time forward, 16 and 17-year-olds that are charged with misdemeanors are considered juvenile delinquents, or JDs, and their cases are decided in family court. For 16 and 17-year-olds that are charged with misdemeanors under the traffic law, they're considered adults and their cases are decided in the criminal court. Adolescent offenders are 16 and 17-year-olds that are charged with felonies, and their cases are typically decided in the youth part of Supreme Court or county court, but they can be removed to family court, and if that happens, then their status changes to juvenile delinquent. So again, I'm touching on these points, but there's kind of more as you get into the details of this. The youth part of the court is a special division of the court to handle raise the age cases, and I'll say a little bit more about that in a few minutes. So on to, we move to juvenile offenders. A juvenile offender is a child who's 13, 14, or 15 years old at the time that they're charged with a serious or violent felony offense. Similar to adolescent offenders, these children's cases are also heard in the youth part of the Supreme or county court, and the youth part is a special branch of the adult criminal court that is then presided over by family court judges. The judges receive specialized training and are prepared to hear and decide these raise the age cases for children and youths that are charged. Juvenile offenders get less severe penalties than adults with similar charges. However, they do retain a permanent record of what they are convicted of unless the court reduces their status. These cases can be transferred to the family court if the court sees fit, and if they're transferred, excuse me, the child is then considered a juvenile delinquent. Excuse me. So again, the adolescent offender is a 16 or 17-year-old that is charged with a felony after October of 2019. And similar to what I had just stated regarding juvenile offenders, the case is heard in the youth part of Supreme or county court, but it may be removed to the family court where the child will then be considered a juvenile delinquent. So once we look at what a child is charged with, then we move on to what is programming, what kind of programming happens for kids. Often in cases where kids have committed crimes, a child will be required to go into a detention setting. So there are three different kinds of detention. There's a non-secure placement, secure, and specialized secure. Specialized secure was added as a result of the raise the age legislation. A non-secure detention is a less restrictive setting, typically for juvenile delinquents that are pending in family court. It's a short-term setting, typically for kids who are not able to be in the community and are waiting another placement. Secure detention is typically reserved for kids who pose the highest risk and are accused of serious offenses. And the court can require secure detention for juvenile delinquents, juvenile offenders, or adolescent offenders, any one of those. So specialized secure detention, as I mentioned before, was created as a result of the 2017 Raise the Age legislation. We didn't have that category of detention programming prior. This option is utilized for adolescent offenders and is used both pre-trial and post-sentencing. Currently, there's a couple challenges specific to specialized secure detention. There's a very limited number of facilities in the state that offer specialized secure detention. And one of the greatest challenges that most, if not all of the specialized secure beds that are available in the state is they have been contracted for by counties. So in other words, the detention bed may not have a child in it at the moment. It may be open, but if one of the counties has contracted for it, what we are experiencing is that when we need a specialized secure detention bed, and we see we attempt to get one, we see that it's an open bed on the census. We try to secure that bed for our kid. Unfortunately, we end up oftentimes being told that that bed's not available because there's a hold on it because of another county contracting for it. So so that has created a real challenge, and I'm going to talk a little bit more about that as we go through some more of the information. The price tag for a specialized secure bed is over $1,000 each program charges a different amount, but it's over $1,000 per day. And so oftentimes what we see is that the larger counties are contracting for those beds, and that the smaller counties are not able to afford putting holds on those beds because it's cost prohibitive to be paying those rates when we may not have a child in that bed most of the year. So let's take a look at Raise the Age services that Tompkins County's provided from October 2017 to May of 2021 this year. This chart shows us the 7 children that have been served during this time period. Foster care in this context refers to not what we think of as fostered in a family setting, but rather being placed in a congregate foster program. So where you see in that column where it says WGA and what looks like CHOW-C, WGA is William George Agency, who runs a congregate foster program, and the other is the Children's Home of Wyoming Conference program that is similar to the William George program. Preventive services in this case refers to services that social services typically contracts for that either prevent the necessity for placement of a child in detention, or services that are provided both before and after a placement to potentially prevent or shorten a placement. These services can be clinical in nature, or they're supports for the family or the child at home or within the community. An example of this is the Youth Advocate Program. People are probably familiar with that program. As you can see, we have only had one child that has actually required specialized secure detention since the Raise the Age legislation went into effect. We were not able to find a specialized secure bed at that time when we needed it. And this has created some pretty significant challenges for our county, and I'll talk more about that in a few minutes. You'll see in a future slide that the sheriff's transports are utilized pretty frequently related to these cases. Kids are transported to and from detention and court appearances. Electronic monitoring refers to usually an ankle bracelet that's provided and monitored by probation. And as noted at the bottom, you'll see that although the Raise the Age is handled by each county, the law requires that children's cases are determined in the county where they were picked up, or were violating the law. And so it's not uncommon that the sheriff's department is transporting kids who are from another county. So this next slide shows the sheriff's transports for Raise the Age kids and the associated costs. Keep in mind that while the costs are specified here, Raise the Age expenses are fully reimbursed by New York State as long as counties remain under the tax cap. Currently, in 2021, we are not under the tax cap, so our Raise the Age expenses would not be reimbursable. However, there is a hardship waiver that the state provides. I'm hopeful that we'll be granted a waiver Currently, we've been requesting from the state numerous times to provide us with the application process for the waiver, and we haven't yet received that, but I'm hopeful that we will. This next slide gives us a picture of some of the details about Tompkins County Raise the Age cases, and this is kind of anecdotal, but wanted to kind of give a bit of a picture of what kind of charges our kids, what kind of crimes are kids being charged with in our county, what is happening that means that a kid is falling under Raise the Age. So information related to children that are assisted by social services is protected information. So all of this, all of the confidential information related to kids is redacted. You can see that the offenses that kids are charged with are pretty serious and create a significant risk for our community. And the intent of the Raise the Age legislation is really to ensure that children get appropriate services that are rehabilitative in nature, and that their education continues in a setting that promotes their development, as opposed to what had been happening before, where kids were incarcerated in adult settings and where children were often at risk. So as I mentioned before, the challenge here is finding the appropriate available detention bed when it's actually needed. To date, there have been 2 cases where an appropriate setting has not been available. But I have to note that in only one of these cases, it was a Raise the Age kid. The other one was a 15-year-old male, as I've got noted here on the slide. So it didn't fall into the Raise the Age category, but I'm noting that because it was a child who we weren't able to serve. So in the first case, the court determined that according to the law, they were required to place the child in specialized secure detention. However, it was the role over a holiday weekend for social services to actually secure that bed. Despite continued diligent efforts, there was not a detention bed available, and the child was held at the sheriff's department for about 2 days before being released into the community with electronic monitoring until a specialized secure bed could be located. In the second case, like I said, the child was not Raise the Age eligible, but he's noted here because, like the child I mentioned before, he also spent about 2 days at the sheriff's department until a secure detention bed could, no, I'm sorry. We tried to find a secure detention bed and it couldn't be located, and he was released to the supervision of probation. There have also been 2 other children that have spent some time at the sheriff's office in the last couple of years waiting for detention options. But again, they were not Raise the Age eligible, but their wait for an appropriate placement demonstrates some of the challenges that we have with securing care currently in New York. So where are we at with serving kids who need detention, particularly Raise the Age kids? When a child needs a detention placement, probation or social services use the state-provided detention risk assessment instrument, or the DRAI, and then a detention census is accessed through the Office of Family and Children's Services. As I mentioned previously, one of the challenges is that the census shows beds that are open, in the sense that a child is not currently occupying that bed. However, if another county has contracted for that bed, while it may show as open on the census, it will likely not be offered to a county that needs that bed. So let's end on a positive note. There's some potentially good news despite the challenges. I think most people are aware that Tompkins County has been part of an 11-county group for some time now that's been looking at the potential of coordinating a project to potentially increase detention services in our region. When COVID-19 impacted everyone, the state and counties were really not sure what was going to happen on the horizon financially, so the project went on pause. Very recently, the state reached out to check in with the 11-county group about their interest in potentially to begin to pursue those options again. This is all very preliminary. There's not a solid plan, but it's being explored currently. We've met twice just recently, and then we'll be meeting with OCFS in the future. And as I know more, I'll share more information as it becomes available. I'm hopeful, but I'm also a bit guarded about it because I also know that the state is really trying to look at things very, kind of scrutinize any kind of financial action right at the moment. Related to this, as recently as last week, people may be aware that the state has reached out to some counties to see if they might have an option of creating space in the local jails to house Raise the Age kids. Our county has currently declined this due to staffing limitations. However, this would also violate the intention and the requirements under the law that are special, really specified by Raise the Age. So I think it may be that in the future, the state specifies that that would be permissible, and then we could consider that, but we would have to look at what the resources are for our county. So as you can see, there are many facets to providing services around the Raise the Age legislation. And while the numbers of children that we've provided services to in the past couple of years is relatively small, there are multiple county departments and the court that all get involved. So it can be a big project. So that's kind of my overview. Do people have questions? I'm going to try to stop.
Yes,
Stop sharing so that we can.
Yes, Mike Sigler.
I'm just wondering, I mean, a couple of those cases are pretty serious. I mean, the knife assault and then the armed robbery. And those folks were let out on probation because we didn't have the bed. So I guess I'm curious, should we be one of those counties that's contracting out for, I don't know, 3 beds with whoever that may be?
Yeah, so I think you bring up a really good point, Mike. And so one of the challenges with contracting for beds, I think that it is certainly something that we as a county may want to consider. One of the challenges is that you've got a multi-faceted system in terms of detention. So you may end up with a kid, depending on what they're recommended by the courts, you may end up with a child that needs to go into non-secure, secure, or specialized secure. So it can be, or you can even be looking at a congregate foster kind of situation. So it can be really difficult. I'm not in any way making a recommendation about whether we should contract or not. One of the challenges with contracting is, what do you contract for? What bed? And then the other challenge is that when we've had these cases come up on a couple of different occasions, we've actually had we've had more than one kid that needs a setting. And so, you can be in a county can still be in a situation if you contract for 1 bed, you can be in a situation where you either don't have the appropriate kind of bed for that child at the time, or you can end up in a situation where you have 3 kids that all need to go. And so you only have 1 bed. But yes, I think we may have to explore how to handle that in the future.
Okay, Martha Robertson.
Yeah, hi, wait,
Wait. Try it again.
I'm having trouble with my audio. Is this okay?
Yes.
Okay. All right. It seems to me that going for reserving a bed is a $365,000 bed. That might need the appropriate bed at the right time. It seems like that's a really not a great bet. It makes sense that the larger counties can do that, can afford to do that. They might actually end up reserving the appropriate beds that they need. It also suggests that the larger counties, if we were to try to lobby the state to change this, which we've been talking about in the Tiger Committee, I didn't realize, okay, it's the larger counties who are doing this reserving. They will have much more political clout than we will. So it may be a fool's errand to try to change state policy on that practice. But I'm very interested, Kit, in hearing that that OCFS is approaching you with a possible solution. So that's great news. Let me just ask a question about probation. You said one of those youth was released to probation. What does probation do with a kid who's obviously been violent? How do they handle that case?
So I'm going to see if Jan wants to speak to that. You're probably better equipped, Jan, to talk about how you guys handle those situations.
Yes, I mean, we've certainly had some very serious offenses that have happened that because secure detention, specialized secure detention wasn't available, that we ended up seeing them. We utilize EM, we have them come in regularly. We try to get services that might be appropriate and that we supervise them while they're in the youth part proceedings. And I mean, really, to tell you the truth, I think we've been lucky. I think we've tried to offer the supervision and the technology that we can. There were a couple of youth who were also under the jurisdiction of Cayuga County, where they, while they were in the youth part proceedings, did hurt someone severely. Now, because Cayuga County was also involved, they were under the probation department, that they really handled the cases. One youth actually was also on parole, so those services stepped in. But really what we try to do is offer supervision. We try to notify the court of their compliance. We can track their whereabouts, and that we try to get them to be involved in services. But you are talking about some very serious cases that maybe should or should not have been placed under our supervision at the time.
And they're obviously living in whatever situation they had previously been living in. Is that right?
Correct.
So that's obviously a challenge. The issue about the tax cap waiver, Kit, did you say, is 2021 the first year we weren't under the tax cap, so we are at risk of losing this reimbursement?
That's correct.
And how long has it been that you've been waiting for the application to apply for the waiver?
Oh, you want to speak to that, Lisa?
I can speak to it. It was as soon as our 2021 budget was passed back in November of 2020. We've been asking both in administration and Tom Herden and DSS. So, and we've just heard, we've gotten responses back, and now they're saying that they will be coming forward with an application soon. So it's been very slow going and not a lot of responsiveness.
So that's 8 or 9 months. Are we the first county that's ever been in a situation that didn't meet the tax cap and therefore had to apply for a waiver?
I don't know the answer to that, but I would find it hard to believe that we would be the first.
Okay, thank you so very much. Appreciate all the information, and thanks for the advocacy on this, Kit.
Absolutely. Thank you.
Amanda, did you have a question?
It was answered, but I'll just say thank you for the presentation and for it's good to have this update. So thank you.
Great. Thanks. And
Well-
I hope that, like I said, I hope that I'll be providing additional updates depending on where things go with this 11 county group. As soon as that seems like it has any traction and I have more information, I'll share. Thanks.
Kid, I just have a couple of questions. I mean, one, has the 11 county group talked about combining their funds to pay the fees?
You're saying to contract for beds,
Yes.
Henry? So the focus of the group prior to COVID-19 happening really was not, it was not with that intention. The intention actually was to look at building a detention site. I think the reality that we all faced at that point was that even if we potentially combined all of our funds, there just aren't right now or I shouldn't say right now, because I don't know if things have changed at all since COVID hit. But when the 11 county group was meeting regularly and planning, it was a reality that the specialized secured detention beds that were available in the state had been contracted for by other counties. So even if we had pulled our funds together, there wouldn't really be a bed to contract for. And I think that's likely still the same situation. There are a very limited number of specialized secured beds across the country. The other challenge that I will say is that some of the programs that run those kinds of programs also don't fill to capacity now because of COVID-19. So you even have, you might have a program that says they have 40 beds, but they may only be actually utilizing 30 beds so that they can eliminate, so that they can allow for enough space to prevent, COVID-19 problems if that becomes an issue. So it's kind of compounded since COVID-19, I would say. So the focus, I think, of the 11 county group, as we get back together, if that in fact gains traction, will be to try to look at can we go ahead with the build. All of that will be dependent upon whether or not OCFS gives us permission financially to move forward.
Okay. Last question by Leslie Schill.
Thank you, Kit. This is a great presentation, a lot to think about. Is the 11 county group talking about creating a facility that then has the multiple layers of security all within one facility? That way it meets any need that might come up from the counties?
So typically with detentions, OCFS oversees all detention programming, and typically with detentions, there's a goal of keeping kids that are charged with various levels of crime separate from one another. And because we would only be, I think if I remember correctly, when the 11 county group was working on it, I think we were talking about being approved for something like a 21 bed kind of facility. So a fairly small facility. The primary goal was going to be to provide specialized secure, but there was the possibility of getting approved, and we were hoping for it, getting approved for a few beds that would be secure detention as well, so that we would have that option. The non-secure, there's actually more of those beds, even though they can be still somewhat hard to come by, but there are more of those beds across the state. And again, because the nature of the kids that go into a non-secure versus the secure and specialized secure, we probably wouldn't get approval for all three in one setting. But if we could get the two, the secure and specialized secure, that would be the goal and the hope, I think, so that we could have those available if needed.
Okay. If there's no further questions, Kit, why don't you give your department update?
Oh, sure. Absolutely.
You have a resolution too that we have to deal with.
Sure. So I can do both of those, Henry, or if you want me to wait on the resolution, whatever you would like.
No, you can,
So
why don't you do the resolution? Why don't we do the resolution first? This is the budget adjustment for social services, document ID number 171. I have Leslie moving, seconded by Amanda. Why don't you talk about the resolution, Kit?
Sure. So very, very appropriate to be doing a Raise the Age presentation today and then talking about this resolution. So we were we were asked back when Raise the Age started to be an anchor county. An anchor county was a few counties across the state that were asked to basically pass through monies to, in our case, it was 2 programs, William George Agency and Children's Home of Wyoming Conference, both of which run congregate foster care programs in our region. We already contract with them for when we need their services. And so really the reason why the state wanted us to be an anchor program or an anchor county was because rather than the state having to make all new contracts with those programs and write those, what they wanted to do was basically just pass us the money and then have us forward it on to those programs, and then we would claim against that money. That was supposed to actually go through, the Anchor County program was actually supposed to go through March 31st of this year, but, oh no, I'm sorry, wait, effective March 31st, it's ending. We were actually supposed to go through, I think, sometime in 2022, but it is ending early. The state has just said that they're gonna pull back on that at this point. They have ended their promise for funding to those programs, and so they're pulling back. So as a result, we had actually budgeted kind of what would be the maximum amount that might get passed to those programs. So this is basically adjusting our budget down by $7.3 million, because with the Anchor County arrangement ending, we will not need to pass that money on to the programs. So so that's what that's about.
Any questions? You want to put up to a vote? Leslie,
Yes.
Amanda,
Yes.
Mike,
Yes.
and the chair also votes yes. That carries. Why don't you give your department update now, Kit?
Sure. So it is a busy time at the Department of Social Services. However, a lot of what is busy, a lot of what's going on right now are things that are, they don't make for a great update. They have to do with things like audits and preparation for budget. So I won't drag you through all of that. We are seeing some changes in our Medicaid program. There's some transition in the way that foster children are accessing Medicaid, and so there's some big transfer there. We are seeing our temporary assistance numbers begin to rise a little bit, as well as our SNAP and HEAP programs. And I think, I think we are in belief that that is because we're moving closer and closer to the eviction moratorium ending. So I think, I think it's perfectly predictable, but we have been kind of realigning things, making sure we have staff in the places that we need them to accommodate a potential significant rise there. We continue to kind of have a hybrid model of people working, more and more in the office, but we also still, just to kind of keep density low, have people, have some people working some from home as well. So I think that's probably the full department update at this point.
Or maybe we should deal with the Ewrap issue now, so we can let you go. And if Kathleen and John are available to talk, they can also tune in.
Sure. So I just want to say, just a moment of explanation about how Ewrap works. So John Mazzello and Kathy are going to talk really about the great services that they, through Human Service Coalition, have been providing in terms of helping people directly with the Ewrap program. Social Services has worked closely with OTDA, who is, providing, who has provided us with the portal for the Ewrap program. And the Ewrap program is the Emergency Rental Assistance Program, just so everybody is familiar with that. That is a program to really try to help people who have lost income, haven't been able to pay rent, may need back rent or prospective rent, and may need help with utilities as a result of COVID-19. So DSS is not providing direct services for the most part around Ewrap. We have contracted with Human Services Coalition, and they've been providing the services around that. So I'm going to turn it over to them to kind of give an update. I have a couple of numbers, but I'll pull those out while they give an update.
Hi, thanks, Henry. I'm going to let John talk mostly about this. This is his program that he runs with his staff. Just one, and he'll probably explain to you, Ewrap is one of a couple programs we have. We're running kind of simultaneously to help people with rent and utilities. So John, take it away.
Thanks, Kathy, and hello, everyone. Thanks for giving us a few minutes to share an update on this program, which I think will be something that is useful for you to know for your constituents as well. We really are hoping to encourage everyone who's eligible to consider applying. So thanks to KIT and DSS, we have been partnering together for the past month or so to be that customer service and outreach face of the Ewrap program in Tompkins County. And I really do want to thank DSS for their partnership over the last month, helping us get ramped up, sharing information from the state, working with us to set things up to best support individuals. So as Kit mentioned, the Ewrap program launched in early June and supports individuals and landlords where if an individual applies, the landlord is going to be the one who gets the money in many cases. So the program can support up to 12 months of back rent or rental arrears, up to 3 months of rent forward or prospective rent, and also for certain situations, gas and utility arrears. So not everyone's eligible for all the pieces, but there's a pretty in-depth application process that is online through a web portal that OTDA has set up. And the role of the Human Services Coalition, or actually 211 as our program that's doing it, is really threefold. So the first is support the individuals who are applying. This could be tenants or landlords. They both have a role in the application process. Much like we did with, for example, the vaccination contacts earlier this year, really the idea is to help people who either don't have access to the internet to submit the application online, people who do have access but can't figure something out or are having trouble, or people who are just, I can't do it. I need somebody to walk through with me. So that's really the first piece, to provide that customer service role. The second is to support outreach, conduct outreach around encouraging people to apply and helping people to know that this program exists. And then the third is to support the court system and people going through the court system with information referrals that can help them to support the needs that might be behind their inability to pay. So this may include helping them go through applications for Ewrap, but it may also include things like other programs or services that can help them out. So over the past month, we've really started the whole thing. It's we didn't see the application too much earlier than anybody who was in the public saw it. And so there's been quite a bit in working with the state to get the kinks worked out and everything. But right now, the focus is on people who have incomes at or below 50% of the area median income, and then who also have some other characteristics, like they've been unemployed for 90 days, or they're a veteran, or they have experienced domestic violence, or they have a pending eviction, or some other things. And then the priority goes up to people who are under 50% AMI without any of those special features, then households that are under 80% AMI. In the first month, there's a prioritization, so the people at the most need get served first. After the first 30 days, so early in July, it's really just going to be first come, first serve. So anybody under 80% AMI is going to be eligible, and it'll just be the order that they apply. So we've ramped up our housing team at 211. We have dedicated portions of 2 of our housing specialists, as well as portions of other 211 staff. Over the past month so far, we've fielded about 220 or more contacts seeking help with the Ewrap applications. It has, ranged from easy questions like what's the website, all the way up to really more complex ones. Those easy questions our 211 staff can respond to right there in real time, whether it's by phone or text or chat. But for those more complicated questions, we are sometimes setting up appointments to call people back, especially because as you might expect for a program of this nature, the application process is not short. It over the phone has been averaging 45 minutes to an hour to do with folks. So sometimes people need to have some time to prepare the information and documentation and info that they'll need even to be able to answer the questions. And currently the state system doesn't really allow for saving and coming back, even though that's something that's in the works. So with those 220 contacts from, really simple questions up to complex, as I mentioned, it's been a time-consuming process to have people apply because they sometimes don't have all the information, but we have now gotten through 18 people who have completely finished their applications with our assistance and uploading their documentation. We have another 41 who are currently pending with assistance. So these are people whose applications will be submitted either by HSC folks or 211 folks on their behalf, or they'll submit themselves just with our assistance. And then another 20 people so far who don't qualify, but we're helping with other resources. So we've really seen over the last couple of days kind of that critical mass start. People are starting to hear about this program. They're starting to work on it. It is kind of daunting to sit down for such a long application. So I think people have kind of put it off. But as the clock is ticking on that special period, people are interested. We've also been receiving a lot more contacts recently from landlords. What can I do to help my tenants sign up? What can I do to do my part to approve the information that my tenants are submitting? So we are seeing kind of growth there. And I'm sure when Kit shares her numbers, which I'm not allowed to share, that she will have similar things about the uptick in the last few days. Really quickly, just to show the other parts, we have a new outreach person who started at Human Services Coalition just a couple weeks ago. Really just getting through the training, but already out in the community talking about this program and other housing programs. Been doing in-person outreach at food pantries downtown around the STAP DSS area. On Thursday was at the No Mas Lagrimas food distribution, starting to put up information at the blue boxes, the mutual aid boxes, working with folks in the West Hill area and the apartment complexes, working with folks who live in mobile home parks. So really focusing on a lot of the areas where people who might be most likely to take advantage of this program are. We have radio ads currently running on Cuga Radio Group. We'll also be doing targeted mailings, social media advertising, bus advertising, and lots of other types of advertising in the weeks to come. So you will be hearing and seeing that coming. And then we'll be starting the planning. Liddy Barger, our Director of Housing Initiatives, and I will be meeting with the folks planning the virtual and in-person supports for people who are going through housing court in the county. We're actually meeting with them tomorrow, so that will be coming soon. As Kathy mentioned, we have a couple other housing supports at HSC right now that you may have heard about. One is the Ithaca Eviction Displacement Defense Project, which is a privately funded project. This is for individuals in the city of Ithaca. So there's some overlap with people who might be eligible for Ewrap, but it's a different program that provides support and funding potentially it'll be up to 48 individuals, a little bit of income every month that can support their rental arrears. And so not only is it the perfect timing for Ewrap, but it provides us with an option for people who may not qualify, but who may otherwise live in the city of Ithaca. If they don't qualify for Ewrap, they may qualify for this program. So I would say for you, certainly I'll stick in the chat when I'm done talking, I'll stick the link for the Ewrap application, but for all of you, if you have constituents who are concerned about their housing or their ability to pay their rent, Ewrap is one of the most generous assistance programs that I think there ever has been. So if someone may be eligible, we really want to encourage them to apply. People can apply on their own, or we welcome contact 211. Just call 211, and or you can chat or otherwise text message us, but we're happy to help provide information and resources all the way through to the either in-person or virtual assistance with actually completing that application.
Yeah, I'm sorry. Thanks, John. If I could just add, if you talk to people, there are a number of people I know who are thinking they don't need to really do this until the moratorium ends. Please encourage them not to wait, because the money's going to go fast, and heaven only knows how long it's going to take them to approve these applications.
Absolutely, and because right now there's a prioritized application window. If you are at higher need or higher need and fit in those categories, it's really going to be better to do it now, because we know people who have, as incomes go up, additional resources go up, you're more likely to have internet access. As that opens up, we're really expecting to see many more applicants, and then it's just going to be going down the list. So if people are eligible now under the priority, we really want to see them get in.
Right. This is kind of exciting time too. I mean, we just got offered from HCR a limited number of enhanced housing choice vouchers. The COC got offered, which pay for things like 120% of fair market rate. They'll pay for moving, security deposits. They'll work with the landlords to help get the apartment ready. They'll cover it for the landlords if the tenant leaves early. I mean, these are like really sweet vouchers. Not a lot of them, but it seems like things just keep coming to help people, renters and people find housing. So it's exciting. It's daunting, but exciting. So.
Before I give the kit, I'll ask Amanda.
Yeah, thanks. Well, I was just thinking as you were talking, John, like, you guys are amazing. I mean, the things that not just you guys, but like everybody, all of you folks, you're just doing so much to really help people. And that's great. And thank you. I did have one question. What is the area median income?
I thought you might ask that. So first, thank you. And on behalf of all the housing providers and others, we presented this at the Homelessness Housing Task Force meeting earlier this month. And I don't know if there were 80 or 90 agency representatives. Some of you were there. I mean, everyone was really interested in this. So I think using the other agencies to get the word out, have this information coming from a trusted source is really, really very important. Because, we can do all the outreach, but if it comes from someone who is known to an individual, it's much more likely to take hold. The area median income varies. I'll stick the chart kind of in there, in the chat here, but it varies depending on the number of people in the community. The 80% number for Tompkins County ranges from, for an individual, a single person household, about $50,000, and kind of works its way up. Like a 5-person household goes all the way up to $77,450. So it's actually a relatively generous number. It will be able to serve a lot of people with that full eligibility.
Great, thank you.
Okay. Martha, I'm going to hold your question and have Kit finish her presentation.
So I just have kind of one quick addition, and thank you, John and Kathy. It has been, you guys have done a fantastic job with this program and really have gone the extra mile for people, and I'm really grateful. We are really limited. I think I might have said this before. We're really limited in terms of the numbers that we can put out about this program publicly. What I can say on a pretty limited basis right now is that currently, with having just started this, did we start this June 1st? Yes, I think so. We are already at about 260 people that have applied for rental help through this program, and around 77 people that are applying for utility assistance. So the numbers are, for such a short time, the numbers are definitely popping right up there, and I think we're going to continue to see those grow. So, so thank you so much for all of the efforts to make this happen for people. So that's all I have to add to that, Henry.
Okay. Well, we'll go for questions. Martha Robertson.
Yeah, thank you so much. Can you hear me?
Yep.
Okay. That was my question, Kit. So you've had 260 people who've applied. But I'm confused that 211 has like got 59 people who've actually completed or have their application pending.
Right, Martha, that's a good
That's a
question.
big difference.
So, yeah, good question. So individuals do, if they don't need any help, they don't need to call us. If they've got the paperwork and they are internet savvy and they can go online, they don't need to talk to us. They can submit the application without any assistance, can just go right online and submit their information. And a landlord as well can go in and do their part. They don't need to talk to us. It's only if someone has a question or needs additional assistance, doesn't have the internet access, can't figure out how to upload a paper, what do I do with this paper document? How do I get it onto the internet? That's the only time they really need to talk to us. They don't need to call us in order to submit the application.
Oh, okay. So Kit, you're saying through the individual's own initiative, those are the numbers that you're seeing from Tompkins County.
Correct.
Okay, do you have any idea whether, like, are those mostly eligible under this first set of priorities, this first month of priorities, or is this kind of all levels of income?
Unfortunately, the information that we receive, Martha, is really limited. We really don't get much of a report in terms of the details of those applications. So I anticipate that as time goes on, we may get more information, and eventually, I think we will get information about the specific applications so that we can follow up on some of the details of that. But I think, at this point, that's all we're getting is some really basic information.
Got it. Okay. Well, I will say that 260 number and plus 77 just for utilities sounds like a much more realistic number of the need in the county. And just finally, the state OTDA, are they the ones who approve or deny the applications?
Right. So OTDA actually processes all the applications, determines all the eligibility. So right now, what we're doing, what really Human Service Coalition is doing locally is assisting people with getting those applications in through the portal. And then OTDA, the state, will do all of the determinations.
And if somebody doesn't get approved, is there any appeal?
I don't think that OTDA, correct me if I'm wrong, John or Kathy, but I don't think OTDA has specifically spoken to that. I think that, I think that this program has really come online very quickly. And my guess is that more, when those issues arise, OTDA will have some direction around it, but I don't think we've been given that.
I don't think so either. There is a growing FAQ. It was like up to 80 questions and it just keeps getting bigger. And we can also submit our own questions. But I think that since we haven't gotten word of any approvals yet, I don't know that one has come up. They're inventing, I think, a lot of this like one day ahead of.
That's a good point. Right now, I don't know if they're going to even tell us if people aren't approved, but that would be great if they could, so we could see if they're eligible for anything else.
All right, thank you so very much. And I'm going to second what Amanda said about that you all are amazing, just to kind of jump right in with both feet and figure these things out. Thank you so very much.
Thank you.
Okay. Leslie?
Yes, thank you. Question about, do you have a sense of how long the program will be open? Have they said how long the window stays open?
It's till supposedly September 2022. I can't believe there's still going to be money left then, but I could be wrong, but that's how long the contract goes through.
All right. And somewhere between now and then, we'll get more information and we might be able to say where municipality by municipality, where the density of applications are or something like this.
Right.
Yeah, I think I'm hopeful. I know that when it comes to that kind of specific data keeping, what OTDA has done, I don't even know who the contractor is, but they have contracted with a provider who's managing the data. Currently, I think that they are still working out the bugs. That's what they've shared with us. They are still working out the bugs of how the data is kept, how it's broken down. So they're really trying to ask us not to share a lot of details about data until they get clearer and they have more solid information. But I think we can anticipate in the future that we will be able to give more information like that. I'm hopeful, at least. So.
Right, particularly for the city to know if they're able to tag into some of these other funding efforts, obviously, if you know where they are. But if there are other municipalities where folks might be eligible for something, certainly you guys are doing a great job plugging everyone into all the opportunities. I can hear that.
But it would help us to know who's
Right.
putting the word and to, where we're missing or where we need to put more effort. So we really hope that they're going to give us more information.
Yeah, we are very hopeful. And I can't say publicly Kit's numbers, but I can share them with my team. And, one of my staff said, well, when we logged in, we find that sometimes people have, or when we talk, if you do a phone application, you have to call the state and do a telephonic signature, which requires them to read you about 15 minutes worth of legal language. And then the individual has to say, I agree. Sometimes when we call in, they will say, oh, this person has 2 applications or 3 applications submitted, probably because a person couldn't figure out how to do it and they kept submitting. We don't know if the numbers are duplicated or unduplicated yet. So we are really hopeful as well to get some additional details because it will help us to target our outreach.
We will share more as we are able and as we know more.
Okay. I've heard that there was an estimate that it would take 4 to 6 weeks before the funding becomes available. Is that true?
Sorry, Henry, we can't hear you.
Okay, that it would take 4 to 6 weeks for the funding to become available. You still can't hear me?
Oh, sometimes.
Did you say 4 to 6 weeks until the funding is made available?
Right.
Okay.
We don't know, do we? How long it's going to take to approve these applications? We haven't been given any estimate of that.
I'm racking my brain here right now if they've given us any sort of estimate, but I'm not remembering anything. All I think they've said at this point is that the state will be processing applications and that the priority will be, as John indicated, the people that are in those priority categories for the first month. But I don't recall them saying exactly what the timeframes are. My guess is, kind of like was indicated before, they're kind of one step ahead of this, but they've also been kind of scrambling to get this up and running. So I'm not sure OTDA really has a way to project right now exactly when they're going to be able to disperse funds. So.
Also, last question, John, did you say that you cannot save an application, that you have to do everything at once?
Yeah, so that's something that's coming. It was in the kind of the instructional videos on the website, but it's not something that's fully working quite yet. So yeah, an individual does have to kind of get it all in. And that's part of the reason someone might want to call us, because then we can also take down the information. And there are some people who are getting kicked out in the same spot, no matter how many times they do it. Something about their information is causing the system to break. It does not mean, though, that you have to get all your documentation in as well. That's a separate process. So if a person can get through the whole application phase, then they need to submit documentation that shows their income and prove their identity and stuff like that, like a driver's license and pay information. That can be done separately. So you don't need to do everything all at once. But yeah, the main bulk of the application at this point, it does need to go all at the same time, but we're hopeful that that will be addressed. And we know that OTDA is working on that. That's been a priority for them to get that piece going.
Okay, last question, Martha.
Yeah, thanks very much. I was wondering about the court. You said you are working with the court system. What does that mean? Does that mean if somebody's kind of in eviction court, you'll help document whatever they need?
So I don't know, Kit, if that's something you want to take. We haven't really had our first meeting to plan it, but I think it's really around having 2-on-1 folks there as a resource to provide information about all the services, the full range of services that might be available, just so if someone is going through and has additional resources, that there's an easy way to tie them into those resources.
Yeah, so I can just add to that. DSS has been working with a group of providers, mostly through the court, to look at putting together an eviction court. It's called Skip Court. I think currently the last word we're hearing on this is that it is kind of on hold for now. I'm not sure where it's going to go, but we have been trying to kind of offer input and some support there. So regardless of whether or not that goes forward and there's actually a formal court process around evictions, or whether it really comes down to just kind of supporting the court in dealing with people that are facing evictions, and supporting the people that are facing evictions, DSS will continue to work with that process, and really try to support people. Obviously, the Ewrap is there, and that's a primary program and a huge program to help people. We also still have the ESG funds, which is the emergency. I'm forgetting now, but it's basically to prevent homelessness. So that is also available, and DSS is administering that. So we have multiple fronts that we're trying to kind of tackle the supports for people around lost rent and lost income due to COVID. So we'll continue to do that.
Okay, that's great. I heard about the Skip Court at the Human Services Coalition Board meeting. Kevin McClafferty from Law New York is going to come to HED and talk about that, like probably in July. So it's great that you're connected to that. Thanks so much. Appreciate it.
Yes, thank you all for your presentations and all that.
Sure, anytime.
And I'll next move on to Office of the Aging with Ms. Billups.
Hi.
Hi.
You cut out. I'm sorry. I'm Karen Bullis.
Okay.
I'm the Deputy Director. I'm in for Lisa, who was unable to make it today.
Yes. You want to give a department update, and then we can move your resolution?
Sure. Just a brief update. We are hoping to unlock our doors on July 12th. We have remained open throughout, but our doors have been locked to the public. So the July 12th date will align nicely with our Senior Farmers Market coupon program, which usually brings a lot of traffic into our office as folks come in to pick up those coupons. So we're looking forward to getting the public back in here. That's all.
Okay. And as a resolution, a budget adjustment, County Office for the Aging 2021 and 2022 unmet need funding, document ID 10191A. Do you have any, and Amanda moves it? Anyone else to second it? Leslie Schill seconds it. Okay, can you talk a little bit about the resolution?
Sure. So we received funding from NYSOFA for our unmet needs program, which is funding that we use to address our wait lists. And in April, we did a transfer from the program expense line into our subcontract line in order to expend the remainder of the 2021 grant period. However, in having done that, we discovered that it then put that line in a negative balance. So this adjustment is to bring that account back up into the positive so that we can continue expending for services and items throughout 2021.
Okay, any questions? Let's put to a vote. Ms. Schill?
Yes.
Amanda Champion?
Yes.
Mike Sigler?
Yes.
And the chair votes yes. And thank you, Karen, for the update.
Thank you.
Okay, thank you. Next, we're going to have Frank Krupa from the Department of Health and Mental Health Services.
Great, thanks, Henry. And I appreciate you letting me spend a few minutes talking about the mobile crisis team. I did want the community to be aware of some of the challenges that we've been facing. First, I think you're all aware that we have a mobile crisis team, which is designed to support individuals in our community that are in crisis, namely a risk to themselves or others. It is staffed by a licensed social worker, and we have a secondary person that does not need to be a licensed social worker, but serves as support and wraparound for the individual post the crisis intervention. We've been running that program for several years now. And when we first started it, it's actually funny because staff brought to my attention that I said to you all when you approved us launching it, that we were expecting 1 or 2 calls a week that we would be managing. And so that's what historically we had seen, and talking with community partners, we thought we would expect. And for the first couple of years, that is about what we saw, and we were able to manage that. Unfortunately, that has changed pretty significantly. And we've done a couple of things. We've merged our daytime call, what used to be called emergency outreach services, with our after hours crisis team to essentially create, one mobile crisis system, 24 hours a day. And we've been covering that with staff that work in the department. So they get a on-call stipend, and then they get additional compensation for any hours that they might work if they do get a call. What we found over the last year or so is that the staff that are willing to do this mobile crisis work has shrunk. And that's really because of the demands that the program has begun to take on those individuals. And so this summer, we kind of came to an acute situation where we didn't have enough people signing up to cover all of the days in our next cycle. So we've been working with the team at the department and county administration to try to find a way to incentivize this work. One of the first pieces that we're working on, and we're in conversations with county admin and the CSEA union, is increasing the compensation for being on call. When we started this program, we modeled the on-call similar to what we had at the health department, where you might get 1 or 2 calls a week. Rarely did you have to go out. And so we modeled the compensation after that. Based on how the program has evolved, we think it's more similar to what Kit and her folks are facing when they are on call and having to deal with some pretty significant situations, having to go out in the field a bit more frequently. And so we're modeling a proposed MOA to the union after the same way that DSS compensates for their on-call. Now, what we know is that simply paying people more doesn't reduce stress or burnout, but what we're hoping is that by increasing the compensation, we'll increase the pool of people interested in participating beyond just the handful that we've had. So we've been working with the other staff at the department, educating them about what mobile crisis is, and working to recruit more folks. We're hopeful that we'll have the situation worked out with the union relatively soon, so that way we can begin scheduling for the rest of the year. Currently, we have through July covered, so we're not in danger of the program not functioning, but we definitely want to have something in place that's a bit more sustainable. I did want to share with you real quickly just a handful of slides that kind of demonstrates the need and how things have adjusted over the last year or so. So this dates you back to December of 2019, and it just shows the steady climb through 2020. And one thing I wanna share, I mentioned at the onset that this is a mobile crisis team. It was initially designed to address individuals that are in crisis, acute crisis, a threat to themselves or others. But as we know, throughout 2020, there was a lot of conversation about public safety reform and having alternatives to law enforcement engaging with individuals in the community. And I guess, fortunately, that began to occur almost organically. And we found that the mobile crisis team was being called out more and more frequently, and not always in instances where the person was in an acute crisis. So the mobile crisis team, as we have it designed right now, is not meant to be that alternative to law enforcement engagement with community individuals that I think we were imagining during the public safety conversations. It really was meant to partner with law enforcement to deal with those folks that were in significant crisis, to hopefully have better outcomes for those individuals. We are not resourced to be able to be that alternative that I think we're all looking for in our community. So, but that doesn't mean, as we were talking about it, it didn't kind of organically start to move that way. And our team did their best to take whatever calls we received and try to support. But as you can see, the numbers have gone up pretty dramatically. What we show there in December is our normal initial winter kind of drop off, but it didn't nearly drop off to where it was in 2019, and it's already continuing to climb through the first 4 months of this year. So what you see here in this particular slide is the distribution of calls between daytime and evening calls. And so what you'll see is, you know, we're already on pace to outpace 2020, both for daytime and after hours calls. And so, you know, we're struggling to be able to, you know, provide enough support to do that, which is why we're looking at ways to incentivize participation and hopefully increase the pool of people willing to serve. Following that same trend, our calls with law enforcement involvement have increased as well. I think we would all say this is a good thing, that we want to have our mental health staff engaged in partnership with our law enforcement folks as much as possible. But again, it just demonstrates that as we had initially designed this program, the demand for its services has increased pretty significantly over time, and the trend is continuing itself into 2021. Probably the most challenging calls are the after hours calls where we are involved with law enforcement, because those tend to be the most acute and severe situations. And again, as you can see, we're already in the first 4 months, we've had to go on site or be in person after hours almost as many times as we did in all of 2020. So the demand continues to increase, and we are very much supportive and interested in continuing to increase our ability to help serve individuals in crisis. The one thing that we just are not resourced to do is be that solution that I think we all want, which is a more comprehensive response to folks in our community that might need supports other than through law enforcement. The challenge has been, you know, there's a lot of conversation about public safety reform. The plan was approved, and then, you know, in the last few months, there's been a void of really any movement on developing that future. And so in that void, our mobile crisis team is kind of getting the brunt of that additional demand. So again, really not an ask at this point from you all. Just wanted you to be aware that this is happening. We've been talking with Lisa, and before Lisa, Jason, you know, keeping them aware of you know, what's going on with the program. And really our hope is that we can get something in place that allows us to stabilize through the rest of this year by bringing more of our staff through incentivizing the work into the program. And then hopefully we'll be moving into those broader conversations about what our community wants to see, of which mobile crisis team, I think, is just one small piece of a much bigger solution that we're all hoping to have. So we are able to absorb these costs in our budget this year. So there is no financial ask for it. We are also in the process of adding an additional social worker to our broader team, in hopes that by bringing caseloads down, that's also another incentivizer for this additional work that, you know, we're asking our team to volunteer for. So we are taking steps to try try to, like I said, incentivize and make it more sustainable for the folks that are doing this work. They are extremely dedicated, and they've been doing, our main backup person did half of the weeks last year. Aaron Volk has been absolutely amazing in stepping in as we needed that second backup person to support the social workers. So there's a lot of dedicated folks trying to make this work, but ultimately there comes a point where it's not sustainable, and so we're really trying to address that now. So I just wanted to share that with the committee, and I'm certainly happy to answer any questions you might have.
Okay, we have a question from Mike Sigler.
Hi, Frank. I'm wondering, I mean, obviously there isn't an unlimited supply of mental health workers. And do you foresee in the future, I mean, if there's a shift of mental health workers over to the public safety department in the city, for example, I mean, do we see we're going to need to beef up our own, because we're going to presumably maybe lose some people as we increase the numbers over at the public safety? I mean, do you foresee that or not foresee that?
Yeah, I mean, recruiting social workers, like most healthcare professions, is challenging because the supply is somewhat limited, and quite frankly, private practice generally is more lucrative, and folks can make more salary that way. But it's a challenge we've been dealing with for a very long time, and I think the benefit of what we're talking about building would far outweigh those challenges, and it would just be something we'd really have to amplify our efforts to recruit high quality social workers to come be part of our team.
Okay, thanks, Frank.
Amanda?
Yeah, thanks, Frank, for the update. You said that with the reimagining public safety that came up a couple months ago, but there hasn't really been any movement on this aspect of it. So you feel like your folks are getting more response to that, but I guess I don't really understand that. Like, do you feel like because the public is aware of the reimagining public safety, you're getting more calls? Or I guess I'm not sure how you feel like that's being affected.
Yeah, I think there's a couple of things. The public is certainly calling on us more frequently through the suicide prevention crisis line, which is kind of the entry point to accessing the team. Law enforcement is calling on us more. I think, obviously they've heard loud and clear that our community wants a different intervention in our community, and so they're reaching out to us. And again, the challenge that we're faced with is the program wasn't designed to really be that. It was really designed to be for those folks that were in acute crisis that we could help support to a better outcome.
Okay, thank you.
Martha?
Thank you, Henry. Thank you, Frank. Great information on the calls. Did you say there's a differential in this kind of after hours on-call service between DSS and mental health?
Yeah.
So what's the differential?
Yeah. So the way that we built it originally with the health department and mental health being similar was it was a dollar value for a weekday and a dollar value for a weekend or holiday, which was significantly lower than the DSS model, which is a few hours of pay. So instead of getting just a base value, there is a salary component that's attached to it. So for example, if you're on call during a weekday, I think you get 2 hours of your salary for being on call. For us, it was $20. Right. So there was a significant difference there. And quite frankly, based on what we were doing previously, the acuteness, the severity of the calls that we were dealing with didn't rise to the level of really what DSS was doing. But as things have evolved, it very much does now mirror more their situation than what we had traditionally done in mental health and public health.
Okay. And so you're planning to, you say you can absorb that increase that you're negotiating for the rest of 2021, you think probably this will require an increase in your target for 2022?
We're still evaluating it, but yes, likely. More likely the additional position that we're putting on board to help spread caseloads around is likely to come to you all as an OTR. We're still evaluating the on-call to see how that will fit into our budget, but it likely will come to you as well.
Okay, and I understand that especially on these kinds of jobs, money can't make you want to do it in a sense, but it certainly helps people feel respected and needed when the value is recognized. So I appreciate your finding this way of trying to stimulate the supply, the pool of people who are willing to do this important work. Thank you.
Okay, and Frank, I have one other question. Your numbers with 2017 look like, were they just a drip?
Yeah, the numbers prior to in 2019, 2018 were much lower, significantly lower. And so it really, when we saw in January of 2020 is really when it started to head on that trajectory, and it has only really continued in that direction.
Yeah, because the reimagining public safety didn't really start until August.
Mm-hmm.
And so I just wonder basically what the jump was that caused it.
Yeah, I think we had started to see that call early on, because as conversations started, we were already having community conversations around mobile crisis and its availability, particularly around the pandemic as well. So that certainly played a role in it as well. But it continued exponentially as the year progressed each month, as conversations evolved.
Okay. Well, why don't you, there's no other questions. Why don't you just give your quick department update?
Sure. So really the main thing from a public health side of things, we're doing more vaccination clinics. We're going out to the Trumansburg Fairgrounds tomorrow in partnership with Grassroots to try to get some folks vaccinated. We have some second dose student clinics this week. Next week, we'll be doing J&J pop-ups in Caroline and Enfield with those folks. And we're beginning to schedule some more of those smaller pods that businesses and organizations had reached out about. So that's beginning to happen. Reach Medical has already done a few. CMC did a couple, and we're picking up the rest now and starting to get those scheduled. So we're really in the mode of taking the vaccine where folks are. And just in preparation for next month, I am planning to bring an update on our merger conversations and where we are with our strategic planning and the work that's going along with that. So we'll have some more information about that for you next month.
Okay, any questions for Frank? I also see that you're getting near zero in total numbers of people infected.
Yeah, we've definitely seen some 0 days. I'd love to see the total cases be zero. I'm not sure that we'll ever do that, but yeah, it's definitely been good, and things are going well in the community.
Yes, thank you for your service. Okay, why don't we move to other department updates? And I see Kate Chang Booth is here. Why don't you give us your update?
Sure. Hello, everyone. So yeah, just a couple of things for us. We're working on our 2022 budgets. Had a meeting with the Resource Allocation Committee last year, or not last year. We did last year too, but also last week. And it's Monday, and so we're getting ready to bring that to a vote at the end of June. So we'll have it ready for county administration. One of the biggest things that's going on with our department right now, and I've mentioned previously in other human service committee meetings, the runaway and homeless youth aspect of our county. We had the Open Doors program that was run by Family and Children's Services, ended up closing that program down at the end of 2020. And so I mentioned that we had several conversations with several local nonprofits trying to find a new home for that. We did end up getting an application from one local nonprofit. After review for the 2021 funds that were allocated for that, our resource allocation committee decided they needed to have a better understanding of what the challenges are facing youth, particularly those ages 12 to 17. At this point, we don't have a youth shelter. We don't have the host homes that are part of the model that the Open Doors program operated under, have not been operational since the COVID began. And so what we've been hearing from some of our local providers is that with COVID being what it is and youth being the last to be vaccinated and some even younger not being able to be vaccinated yet, the ability for these youth to couch surf, which is really what youth homelessness looks like, particularly for this area that we're talking about, this age group, is really non-existent. And them not being in school and financial issues and from different families and all those types of things. So what we ended up doing was June 7th, a couple of weeks ago today, ended up having a community conversation. It was hosted on Zoom. We had about 40 adults and about 20 local organizations that were represented, and really tried to get an understanding of what resources are available, trying to do some asset mapping to see what's out there, really trying to get an understanding of the funds that we do have available from 2021 and then even into 2022 for our resource allocation, where what would be the best use of those funds. We do provide some funding. Our HY funding is divided up into type 1 and type 2. Our type 1 funding deals with the host home model that we're looking at. And then the type 2 is what funds the TILPs through the learning web. And so trying to figure out, and those I think start at 16 and go up to roughly 21, but the demand for those outweighs the availability, right? Those are scattered apartments throughout. And so it's difficult. And what we really tried to understand is how can we help families navigate and reunite, which was really the focus of the Open Doors program. And really tried to understand that in 2019, it's the numbers that we have, and this includes tabling, outreach, and different things, but the Open Doors program roughly touched about 200 to 250 youth in some form or fashion. Only about 10 of those were actually in need of respite. And those stays range from one night all the way up to 30 plus days. But at this point, when those calls come in or when the nonprofits are trying to deal with them, we don't have any place to put those youth, so we've had conversations with DSS. We're looking at potential for foster care. There's not enough foster care homes to go around. And typically foster care parents aren't particularly apt to take the youth in this age range. And so we're trying to work with Human Services Coalition, Liddy Barger. There is a HUD grant has come down the YHDP, which stands for Youth Homeless Demonstration Program. Is a pretty substantial grant that Tompkins County applied for a few years ago. We did not get it. They do urban competitions, and then they also do rural competitions, and we were placed in the urban, and because of that we weren't able to receive the funds, but we've worked with that, and now we're going to be competing in for the rural funds, and because we provided experience with the 100-day youth challenge, which we did in 2019. We were able to begin some of this collaboration and working with our local partners to see if we can get a base of that. And I think so we're in a really good position for that. One of the key components of this will be a youth advisory board. And so we're working with Learning Web and the Village of Ithaca. Liddy has secured some funding from a local provider to actually compensate some youth with lived experience to come, and they actually sign off on all the different components of this grant. But one of the things that we're talking to county administration about is maybe how to deal with this youth homelessness issue when we're talking this 12 to 17-year-old, and even the older for the 18-year-olds. What we're hearing from them is they don't feel necessarily safe going into the shelter. And so, along with what Kit has been talking about, along with what, DSS was talking, or probation was talking about, this also sort of spills over to our CSEC, which is the sexual exploitation of children. If a situation comes up where we need to house a youth, at this point, we don't have any place to put them either. This is not just a Tompkins County issue. This is something that we're seeing and talking about my colleagues from all over the state. And so we're trying to be collaborative and address that. But we're excited about this YHDP grant that will come down, and that will provide some significant funding and a planning period, which will allow us to really put in some different projects that will hopefully be funded. I think those funds can't necessarily be used for a youth shelter, but it could be a drop-in center. And that's sort of really what we're tackling and trying to move forward and see if we can't find something to help with immediate need here. We're also trying to maybe look at dealing with some of the local faith communities. trying to do the thing with this youth group is that this youth age group is that we want to keep them local. So the hosting program allows us to do that instead of sending them away to a center that would be out of county. We have explored some of those options as well. But we're excited by some of the things that came out of the conversation, but there's a lot of work that needs to be done on that. So respite and a place to put these youth, even if it's, there's not necessarily a lot of overlap in the type of secure center that we would have to have, or places we'd have to have. And it's not something but it is something that would have to be vetted and approved by OCFS as well. So just to kind of put that on your radar, that this conversation, there's a whole gamut of housing needs and youth, by intervening with these families now, it's preventative, right? So it helps these youth hopefully to stop and get involved with the system and become some of these youth that need some of these more higher expensive things later on, as far as like interventions and housing issues. So that's what we're working on.
Any questions, Kate? Okay. Why don't we move to the next department? Reverend Clark, how about Office of Human Rights?
Okay, good afternoon. Excuse me, everyone. Just a few updates to share with you. At the end of this week, we will be hosting 2 programs. On Thursday at noon, we will be hosting a program on violence in Ithaca and American society. Panelists for that program will be Travis Brooks from GIAC, who is also running for a seat in the legislature, Professor Sabrina Kareem, who's a professor of government at Cornell, Richard Rivera from OAR and Ultimate Reentry Program, and Professor Raza Rumi Ahmad, who is the director of IC's Park Center for Independent Media. The next day, we will be doing a Pride Month event, in which is being called LGBTQ plus resiliency in the age of COVID. That also will occur at noon on Friday. And this will be a community conversation that will be in which we will have 2 co-moderators, one of which is our own Kate Shanks Booth, and Gerald Osorto, who's the executive director for Student Equity and Belonging, and the director of the Office of Religious and Spiritual Life at IC. And some of the questions that'll be raised with the audience will be, for example, how did persons in the LGBT community find or create community during the pandemic? What enabled them to be resilient? Asking questions about how does COVID, the LGBTQ plus experience, and the national racial reckoning, which impacts in particular African American and Asian Pacific Islander communities intersect, among other questions. We will also be doing an online raffle of LGBTQ plus themed items just prior to the program starts. So this program will be from 12 to 1:15 on this coming Friday. I've also too been involved with, was involved with last week's event with the planning and implementation of the Juneteenth events hosted by the county, which was a week-long celebration and culminated with the news of the Juneteenth now becoming a federal holiday. And so we really had some outstanding events and discussions during last week's event, and we culminated with a play which sort of reenacted the experience of 3 veterans of the Civil War who were enlisted right at St. James Army Zion Church on Cleveland Avenue in 1863 and 64, and their experience of coming back after the war. A Juneteenth play which was created by Leslin and the county historian, Carol Cammon. I also did a presentation to statewide human rights commissions convening in May on talking about the Office of Human Rights here, the Human Rights Commission, and the programming that our office has been doing. And this has been part of an effort, as I think I may have mentioned in previous meetings, in which the New York State Division of Human Rights is seeking to engage local commissions and offices of human rights, such as ours, who operate at the county or the city level, in partnership with one another, and seeks to have us in ongoing sort of engagement on a quarterly basis. And I'm part of a planning group that's involved with helping to make that happen. Last thing I'll mention is that we are considering a reopening of the office sometime in July. We have not pinpointed a date as of yet, but I think that we are about ready to transition back into receiving walk-ins and, operating under the appropriate COVID protocols. But I think that we are at the point where we can begin to reopen our doors for the first time in 15 or 16 months. So that's my report from OHR.
Any questions? Okay, thank you, Reverend Clark, for that update. Kathy Slaughter, Human Services Coalition.
Hi, thanks, Henry. I don't have a lot more to say. I just wanted to say that it heartens me as I listen to this to hear about all the different ways that HSC is collaborating with agencies and departments. We just finished our review process, their agency review process, and one of the questions that we asked this year was, what do you think we're doing better this year than we did last year, a year ago? And almost every agency had mentioned that though we were good at collaboration, that our collaboration has gotten so much better, and that everybody's putting their resources on the line to make the programs that need to happen this year. So it just, it felt really good, and that's about all. Thanks.
Okay, thank you. And last but not least, J.R. Claiborne from the Veteran Affairs Office.
All right, hello everybody. Okay, so I guess it sounds like between Karen with COFA and Ken with OHR, that's half of my report, if not most of it. But I will just start off with, as Karen had mentioned about COFA opening, same for me and my department, July 12th right now. That Monday is what we're targeting for opening, and trying to figure out how to balance that, cross that balance with following COVID protocols and having folks be a little more relaxed and still providing service to them. Also, the late last month, and I'm bringing this to you at this point because this is our first meeting since then. I think it was my second month here with the county. The legislature, you all passed a resolution in support of Seneca County and the Sampson's Veterans Cemetery, vying to be the state's first veterans designated the state's first veterans designated cemetery. Well, that actually happened in late May, so just before Memorial Day. So I want to let you know that you had a hand in making that happen, and Sampson is now the officially New York State's Veterans Memorial Cemetery. So applause to all of you for that support. Also, well, as Reverend Clark said, I was also part of the planning committee for the Juneteenth, all the Juneteenth events, and particularly took pride in being able to have my department co-sponsor the appearance or the screening of Civil Warriors, which was a Ithaca movie created by Photosynthesis Productions, and it was adapted from a play done by Carol Kamen, and something that Leslin, being Claiborne, helped with doing when they were trying to get the monument beside St. James AME Zion created and installed. And Civil Warriors looks at that whole story through the stories of two father and son duos who enlisted for the Civil War at St. James AME Zion. And through those two duos, they're funneling the stories of the 26 families who their men actually enlisted here in Tompkins. So it's pretty cool to be able to bring to the public this part of our local history, Tompkins County history, that a lot of people don't know about. I know I've learned, even though I've seen the movie a couple of times, I've still learned some things happening with it. And we had a very enlightening Q&A with, following with the narrator of the movie, which is Dr. Sean Eversley Bradwell from Ithaca College. And he brought in Deborah Horde from PSP to help shed a little more extra detail in the movie and how it came about. So that was really cool. The last couple of things is our Veterans Coffee House, because summer is here. It's definitely official. I think 90-degree days is a good indication. We're looking at seeing if we can move our coffee house sessions to outside, move away from virtual, but we would also like to be able to try and keep the virtual component. So we're looking, tinkering with our calendars and things for that. So you'll be amongst those in the know when that happens. And then lastly, just wanted to throw out a little kudos. Cornell's ROTC Brigade received the both state and national honors by the Vietnam Veterans of America organizations for the various things that they've been involved with here locally. They were nominated by the local chapter number 377 for just a number of things that they did, ranging from the Watch Fire video all the way to helping on Vietnam Memorial Day, Vietnam War Day. They actually helped coordinate a phone tree where every veteran in the organization received a call from someone, one of the Cornell ROTC cadets, and myself, I included in that too, just to reach out and say hello, say thank you, and just check in with the veterans, many of whom were at home. So that's the big highlights for me for the month. Thank you, in case there's any questions. All right.
Okay, no questions. Thank you for that report. I'm going to move now to the advisory. Jackie Wunderlich for the Development Disabled Subcommittee and Patricia Buchel for the Youth Services Advisory Board. I have a motion to approve those two appointments. A motion by Amanda Champion, seconded by Leslie Schill. Thank you. Any questions, any comments? Okay, let's call our vote. Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler, and Henry Granison also votes yes. Votes pass unanimously for all. Now we have the minutes approval. We have two sets of minutes, one for May 17th, 2021, and one for June 1st, 2021. I entertain a motion to move it. Amanda Champion and Leslie Schill again. Leslie seconds. And again, any questions, any comments, any changes to the minute? Okay, let's call for a vote. Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
and the chair also votes yes. So do we have any comments from the committee members or liaison assignment reports? Nope. Okay. How about a motion to adjourn? Mike Sigler, seconded by Amanda Champion. We can all raise our hands to vote to adjourn, and we finished 5 minutes
Yes.
early. Okay. Thank you and goodbye.
Thanks, Henry.
Thank you.